Good morning, everyone. Great to see you, and thank you again for making the trip out here. I would like to start with Introduction to Macular Degeneration, and many of you know this, but maybe we can go over some things that are new to you, and certainly it's a good refresher. You will hear throughout the morning people referring to these categories of wet and dry macular degeneration. You'll hear some of us repeating this. I always think that's a good thing because repetition allows us to learn. So I can tell you that you can't see your retina. The first picture is a picture of the outside of an eye where we can see the cornea, we can see the iris, we can see your pupil. We cannot see your retina. And although there's lots of things that might affect the outside of your eye, causing the outside of the eye to be red or to be tearing, that's not part of a retinal condition. So the retina is this structure in the back, and it's big. It's a big picture because it's really lining the inside of the eye. It looks orange, sort of gray and orange, and in the very center, that red circle is where the macula is. So macula is part of the retina. The macular degeneration means the center of the retina is what's affected. But again, you can't see it. Nobody can see your retina unless we look in, and we need to have a dilated exam. So, as most of us know, we can have dry macular degeneration and we can have wet. But just to make it clear, everyone starts with dry. So if you have macular degeneration, it started dry. And that means there's no sign of blood or fluid, but some signs that we can see when we dilate your eye. We can see these little yellow spots and little bits of pigment in the retina. So that is the sign of macular degeneration in the dry form. Drusen, you've heard that word, and pigment. Those are things we look for when we're examining your eyes. The wet form means now there's blood. So the blood or fluid from our blood, the serum from our blood, is also present. And that's typically the more severe form when people definitely have a change in their vision. So dry macular degeneration, again, no blood, no fluid, just these drusen spots or pigment, can cause a gradual change in vision over time. It could be years. It could change very, very slowly. However, some people with dry macular degeneration also have a significant loss of vision. They lose vision because the retina becomes too thin or atrophic. That's a slow process. For patients with dry, about 10% will go on to get wet. So it's a small portion. Most patients with macular degeneration have dry. Some, it's so mild they don't know they have it. But that small percentage will get wet. And those folks, if that happens, generally have a fast or rapid change in vision. So the change in vision can happen overnight because there's suddenly blood. Suddenly the center of the vision is distorted or very dark. Just to show you that the dry form also can lead to loss of vision. And these pictures show you what we see, that there are these yellow spots. But in addition, on the right-hand side, there's a more orange area in the center. That's where the retina is thin. And that's where people lose patches of vision. Those are patches where the retina is very thin, and they can no longer see through that area or not see clearly. So dry macular degeneration, that's what all patients with macular degeneration start out dry, and some can become quite severe. This is less than 10%, so perhaps 3 to 5% of all patients. In this country, however, we have 15 million people with dry macular degeneration. Finally, the two types, just to emphasize, is the dry and the wet. But patients with mild dry macular degeneration do notice some changes in their vision. So although we may measure your vision to be 20/20, and we consider 20/20 to be normal, perfect vision, it's not always so perfect. So for patients, it can definitely be hard to see at night. If you have dry macular degeneration, nighttime vision might be difficult. It may be difficult to read unless the print is very dark and large enough. So it's difficult because the contrast isn't often good. If you're looking at a paperback book or a phone book, those sorts of things are difficult where the quality of the paper and the print is not quite good enough. And it can be hard to see color. Your central vision is what you use for color vision, and if there's any issues in the center of your vision, your macula, you may have difficulty with color. Patients then can lose central vision from both the dry and the wet, and you're going to hear about that today. We have a total of 10 speakers for you today, and I would like to introduce our very next speaker. I'm going to show you the list. Here's our lineup for prevention of AMD, treatment and research in AMD, coping with vision loss, the aging eye, genetics, nutrition, and stem cell therapy. So those are all the topics that you see in your program. Thanks.